you've talked about dealing with pain and how you can help people with that. What are some other things that people might not realize that chiropractic care can do? You know, I've talked to people, other chiropractors that can deal with improving functions of certain organs, digestion, where I think a lot of people are now understanding that's where your health may be one of the places to start. I mean, what sort of other things that do you deal with that people might not realize go along with chiropractic?
Sure. Yeah, again, everything in your body needs nerve supply, blood, and oxygen. So, for instance, I told you earlier, your nerves not only control pain, so most of our patients come in with pain. People forget, though, 2/3 of a nerve fiber isn't for, 1/3 of a nerve is for pain. The other 2/3 are for muscles. The other 1/3 is for organ function. So I tell you, probably 40–50% of my patients that come in with chronic low back pain, those are the same nerves that innervate your colon, bladder, women uterus, men our prostate. So I've seen everything from constipation, that's a huge one, to menstrual cramping with females. I've seen men with impotence come in, and you know, not every case of those is from a damaged or irritated nerve, but more often than not, there's a correlation. Mid-back is really big, like you said, for digestion, so a lot of reflux, heartburn, bloating. Of course, your digestive tract is where your immune system hangs out. You know, anyone who's got digestive issues typically is going to have immune system issues, or autoimmunity is huge there. Neck, we're talking balance center, so we can see people suffer vertigo. Ringing in the ears, very common. Neck, your thyroid is here. This is a big one I see with fibromyalgia patients. Your thyroid is kind of one of your master control glands. So, for instance, a lot of people with chronic pain or fibromyalgia have had a trauma to their head or neck or upper back, and shortly thereafter they start developing this hypersensitivity to pain. And again, your nerves are more than just how you feel. Your nerves are how you function on a day-to-day basis. So if we can find where they're being damaged or irritated and remove that pressure, I mean, we don't advertise we can help all these things, but a lot of times they do, and sometimes they don't.
So again, you said that people go to you sometimes as a last resort, or at least one of the last resorts.
Yeah.
What's the difference in general terms if somebody comes to you prior to that, or just with maintenance before they get on a 10-year subscription or prescription plan or surgeries and things like that? What can be the difference in somebody that does that path where they see you on a somewhat regular basis instead of coming to you as a last resort?
Well, again, an ounce of prevention worth a pound of cure. So it's like your oil changes. I know people that they don't change your oil until it smokes, and you know, right off the bat they're saving money in time. But when their engine blows at 50,000, then you know. So again, cost comparison. You know, back surgery. You know, we go back to the spine. Back surgery is one of the most costly procedures. It's also one of the highest failure rates, especially when they start doing fusion. So you could see me every day of your life, Scott, and I wouldn't even come close to what one back surgery. I had a patient this morning, she's had 18 back surgeries. She's had 15 on her low back, she's had 3 on her neck. And you know, sometimes patients say, well, I didn't have to pay for it. Well, we all pay for it. Nothing's free. You know, we all pay insurance premiums, and I don't know about yours, but mine go up every single year. And you know, all that someone's paying for it. You know, and I always tease with patients. I said, well, did you get your money back? Of course not, right? So, but yeah, the goal is to get to someone conservatively. You can always go have a back surgery, and trust me, at times it's necessary, or a knee surgery. There's times I've even had to refer out where patients say, I gotta do something, but you know, the goal is it's always more cost effective, and not only that, quality of life effective to go conservative, whether it's physical therapy, acupuncture, hyperbaric chamber, massage therapy, chiropractic. You know, once you start opening up the body, there's things sometimes that are done that you can't undo, and there's points at which you go past you can't ever come back from.